All right, so good morning, everyone. Get going. It's almost 9:45 already, so we are recording this meeting, so your presence here is a consent that that's okay. So we just wanted to let you know that, and we always make these recordings available so that you can go back and listen if you so choose. I'm Janine Logan with the Long Island Health Collaborative, Director of Long Island Health Collaborative. I also serve in the role as VP Communications and Population Health for the Nassau Suffolk Hospital Council, which manages and oversees the Long Island Health Collaborative. And I think, we'll do intros real quick around the room, just say your name and where you're from. Because we do have a guest here, and I'm going to introduce her in a couple of minutes, who's going to get an award, and I'll explain why. So.
Good morning, everyone. My name is Mayra Villatoro. I'm with Youth Enrichment Services Comms team.
Hello, everyone. My name is Elizabeth, and I'm also part of the Youth Enrichment Service with the Comms Division.
Hello, everyone. My name is Christopher Sikora. I am from Ultralink Healthcare Solutions.
Good morning, Ellen Higgins from the Suffolk County Department of Health, Perinatal Health, Home Visiting Program.
Good morning, I'm Keasha. I'm from Northville Community Outreach Center.
Hello, my name is Dijon Strange and I'm from Cancer Services Program of Suffolk County.
Good morning, everyone. I'm Maria McHugh. I'm from Stony Brook Children's, and I am in the Adolescent Medicine Division, working with sexual and reproductive health in our young people.
Brooke Oliveri, manager of the Long Island Health Collaborative.
Kamona Tracy, Director of Community Education and Outreach at NYU Langone Health on the Long Island campus.
Jenna Laos, program manager at NYU Langone. I work under Kamona.
Susan McKay, PhD student and member of Eastern Nursing Research Society.
Vanessa Moses, I'm the program coordinator for the Safe Senior Prevention Coalition over at Family and Children's Association.
Hi, I'm Nadine Wilches, CEO and founder of My Dark Health.
Okay, and real quick on the those who are joining us virtually, I'll just call your name out in the order that I see it. So Christine Duffy. Just say hello and.
Yes, hello, Chris Duffy, project manager from St. Mary's Healthcare System for Children. We are in the 5 boroughs, but we're also way out in Suffolk and Nassau. Home care services, care coordination services, medical day program for young adults.
And I can't read, is it Greta?
Greta Gorton.
Greta Gorton, yeah. Hi, Greta.
Good morning, Greta Gorton from Long Island Coalition for the Homeless. We operate a number of street outreach teams and other services for folks who are living unsheltered or unhoused throughout Nassau and Suffolk counties.
Chris Hendricks.
Hi, I'm Chris Hendricks. I'm the System VP for Catholic Health, coordinating all their community outreach efforts, and you'll hear a little more later.
Very good. Karen Kirschbaum.
Good morning, everybody. I'm Karen Kirschbaum. I'm with Creating Healthy Schools and Communities. I'm a school and community coordinator for the state grant at Western Suffolk BOCES. Sorry about that. Good morning.
And Kathleen Emmett. Oh, you're on mute.
Sorry. Hi, I'm Kathy Emmett. I'm the nutrition program manager here at Island Harvest Food Bank.
Oh, nice to meet you. And Annalee Trask.
Good morning, I'm Analia Trask. I am a program coordinator for the Cancer Prevention and Action Grant in the Office of Community Outreach and Engagement at Stony Brook Cancer Center. Thank you.
And Jennifer, I can't see,
Farnham. Hi, I'm Jennifer Farnham. I work with Eastern Suffolk BOCES, and I also chair the Suffolk County Advisory Board on Child Protection Services. Nice to see you all.
And Diana Loomis.
Hi, good morning. Diana Loomis. I'm the outreach manager here in Long Island with Montanito and Affiliates. We're a national eating disorder treatment provider.
Eileen Patilatieri. Hello there.
Hi, Colin Terry. I'm the program manager for the Mora Foundation for Breast Health Education.
And Julie Harshnisher. how do I say it?
Harnisher. Good morning. Julie Harnisher, Hi, nice to see you. Julie Harnisher, Vice President, Population Health for Harmony Healthcare Long Island, formerly Long Island FQHC. Nice to be here. Thank you.
And Hannah O'Neill.
Hi, I'm Hannah. I'm with the Moore Foundation for Breast Health Education as well. I'm the program intern.
Sarah Logan.
Hi, everyone. My name is Sarah Logan. I'm the communications coordinator at iPro.
And Daniel Craig.
Hi, I'm Danielle. There we go.
Danielle.
Hi, I'm Danielle Craig. I'm the the medical program admin for Suffolk County Department of Health.
Okay. And Cynthia Friedman. I know she's with the Department of Suffolk County Department of Health. Maybe she.
Yeah, she's my boss and medical director of the
Yeah,
Suffolk County Department of Health.
stepped away for a moment. Christine Duffy.
Oh, yeah, there's
Oh,
two. Yeah.
Oh, there's two.
She's joined twice, I think.
I forwarded it to my colleague who's director of our care coordination program. She might be on.
Okay. Okay, Jessipina Caravella.
Hi, I'm Giuseppina. I am a health education specialist with Stony Brook Cancer Center, Office of Community Outreach and Engagement.
And Tari Ajay, if I'm pronouncing that correctly. Hello? Some people might be grabbing a cup of coffee, I have a feeling. Siri Pedineni?
Hi, yeah, I'm Siri Pedinini. I'm an associate project coordinator from the Be Free team at Cohen Children's Medical Center.
Okay, nice. And Rena Becknow Lim?
Hi, good morning. My name is Raina Beckno-Lim. I'm a health communications specialist doing outreach with the U.S. Food and Drug Administration's Office of Regulatory Affairs. I'm based on Long Island and basically a New York City metropolitan area. Happy to be here.
Yeah, happy to have you. Angelica Joshi?
Hi, everyone. I'm Angelica Joshi, and I'm another associate project coordinator from the Be Free team.
And Kelly DeVito.
Good morning, Kelly DeVito, Horizons Counseling Education Center.
Hi, Kelly. And Grace Kelly McGovern.
Good morning. I'm Grace Kelly McGovern, the Director of Public Information for the Suffolk County Department of Health Services.
Wow, we have more.
Yeah.
Where are we?
Adesua
Adessa Watson, yeah.
Good morning, everyone. My name is Adesua Watson. I'm the director of the Office of Minority Health, which is under the Suffolk County Health Department, and also the chair of the Multicultural Advisory Committee, which looks at behavioral health in communities of color, and that sits under our Division of Community Mental Hygiene.
Jacqueline Grimaldi.
Hi, everyone. Jackie Grimaldi. I'm a health educator specialist with Stony Brook Cancer Center, Office of Community Outreach and Engagement.
Ebony, I can't see the full last name.
Hi, I'm Ebony McFadder. I'm here with Chris Duffy. I'm the Director of Care Coordination Services at St. Mary's Healthcare System for Children. We provide case management services under the Health Home Serving Children program in the downstate area of New York.
Ed Brennan. I know he's from Long Island Community Hospital. Are you there, Ed? Maybe not. Okay. Laura, did I catch Laura?
I think Laura's our last one.
Laura, is it Cullen?
Hi, everybody. My name is Laura Callan, and I am the Peer Workforce Development Program Director here at Hands Across Long Island.
Okay, I think that's it. Well, we have quite a crew here. We have hospital representation, we have regulatory representations, variety of community-based organizations, quality institutions, nursing representation. Quite impressive group that we've assembled. FQHC representation, Haven't seen Julie in some time, so great to see you, Julie. Really, mental health representation providers, really impressed, especially that it's like December and people are starting to think holiday mode. So really, thank you all for being here. We're gonna start the program now with I'd like to, there's a very special guest I have with me. Can you all see her? Here she is, Dr. Keasha Guerrier. Here she is. She is the recipient of our inaugural Community Champion Award, and she epitomizes what the word community champion means, or what that phrase means. She has led numerous walks for the Long Island Health Collaborative with the community. In rainstorms,
As you can see.
in like heat, one in Belmont was like 95-degree heat. When she's pregnant, when she's not pregnant and she's pushing babies. She has been here with us, never says no. She's also led some Talk with the Docs through our affiliation with AARP. She's primary care physician, and what I love about her, one, that she's always there, never says no, but she's able to impart information about primary care, exercise, nutrition, what is hypertension, why do you have to, in such an easy to understand way. And she always has a group of people, who are gathered around her who want to hear more, because that's what we do with the walks, with the Walk with the Docs, which is a national movement that started in Toledo, Ohio, Cleveland or Toledo, I'm not quite sure, by a cardiologist some years ago who advised his patients to go walk for exercise. And he thought, well, maybe I should walk with them. So that's how he started the Walk with the Docs, international movement actually now. And we started a chapter here through the Long Island Health Collaborative. And so we have to get doctors to speak for about 10-15 minutes, and then they lead us on a walk. And Keasha has led us on quite a number of walks. And she, what I say, walks the talk, right? So she embodies what the Long Island Health Collaborative is about. Chronic disease is our focus area, as is mental health. I think they're kind of related, right? Can't have good physical health if you don't have good mental health. And she's the doctor, and she always reaffirms what I say, but she explains it much better than I do, that diet and exercise, right, are the two ways, and the collaborative has embraced that you can best manage chronic disease, which 1 in every 2 adults has some kind of chronic disease, according to the CDC, or prevent the onset, right? You don't want it. So she talks about that in such a understandable way. She's so personable, she's so approachable, and I've been thinking about wanting to honor you for some time, and I said, I'm doing it this year. So we designed this Community Champion Award, which will be presented yearly to somebody who really goes above and beyond working with the collaborative, and also embodying the mission of the collaborative. And Dr. Keasha Guerrier certainly does that, and then some. So I have a certificate for you. Not that you probably don't need it. And her husband Michael is here with her. He's also always accompanies her on many of the walks along with the children. Sometimes he's like, has to go back because the child is misbehaving, and he has 2 sons. She has a 6-month-old and a 2.5-year-old. She's amazing, and she's leaving now to go see patients in her local practice after this. So she really is amazing. So we wanted to, we just wanted to give this to you. We are so proud to have you involved with us. Do you want to take a?
I was just gonna say, can we take a photo over there?
Oh, you want to take a photo of it? To have you as a partner.
Oh, thank you.
So we. She is what a physician should be. They're all going to want to sign up now and come see you as your partner. She said she'd pencil us in at any time. Wait, I'm thinking Oh, yeah, picture. Okay. You should come in too. No, she's great.
Okay, 1, 2, 3. Let's take one this way, and I'll do your That's beautiful.
Oh, this is
Grateful for you. Thank
okay.
you.
Do you want to say a few words?
Sure. So it's an honor. I really thank you so much for this. You know, I was explaining that I was a physician at LIJ Valley Stream, which is in Nassau, and I think it was maybe pre-pandemic. I think it was.
Oh, it was pre-pandemic,
Yeah.
absolutely.
And someone made a very important connection. And because I've always said, you know, they say young people, okay, you're going to become a doctor, but you're going to lose all those ideas that you have about like really reaching people and like each one teach one. And I've been fortunate to have people kind of foster that in me as I've grown in my practice. And the medical director said, this is something you should be involved in, you know. It's a walk, you got to talk about some stuff, and then, you know, you'll walk around some parks. And I'm like, okay, I'll do it. I did not know how transformative it would be. I really didn't. I think working with Janine and Brooke over these last couple of years, meeting people where they are, right? And breaking things down in a way that is tangible, that's actionable, that's reachable, has really made the difference. It's actually changed the way that I speak to people in my practice, right? So this is, I don't take this lightly. This is an honor to see.
And believe me, we call her chances now.
And it's truly community, right? Because as she said, we have little kids, but sometimes they're my little kids who are behaving badly.
Sometimes little kids are there.
And
Sometimes adolescents are there.
and as we're walking, people are.
Geriatrics, right?
Yeah.
People with canes sometimes and
Absolutely,
walkers, right?
Absolutely, and everybody is able to do what they can, and I think that's what I would say. So I think everyone that's here today, just listening to who's represented in this room, the work that you do, kind of bridging that mental health, physical health, and then that continuity, you know, from women to children, eating disorders. So I applaud everyone in this room. Thank you for the work that you do. You make my work infinitesimally easier. So, thank you guys.
Thank you. Whether perhaps gets a little nicer before we do that. Okay, so thank you so much, and thank you for lending us your wonderful wife.
No problem.
No problem.
Have a good day.
Got a lot of congrats in the chat too. Yeah, congrats in the chat. Thank you. You just, you walked in after.
Oh, if you'd like
Yeah,
to-
good morning.
Yeah.
My name is Manad. I'm with the Nassau Community College Center for
Oh.
Development.
Nice to meet you. You squeeze you up here.
Mhm.
This is
Mhm.
chair
Yeah.
over there.
Thank you.
Doesn't matter. I don't want you sitting left out like that. We just put your chair up. Yeah, I'm left out. Nobody gets left out. All right. She's amazing. I know some of you in this room perhaps, and some of you on the virtual, dialed in virtually have walked with, Dr. Guerrier in the past, and she is all that, she's the real deal. She's with the way you want a physician, type of physician. you want.
Definitely.
All right, so
Alrighty.
so that's that.
So,
You can take it from here.
so next we have our Long Island Health Collaborative Member Spotlight, which you might remember, I think it was maybe 2 meetings ago that we started doing this, where we randomly choose a member to highlight and speak about some of the services that they want to highlight for other members. So we have Chris Hendricks, VP of Community Outreach, here with us virtually. And she is going to talk a little bit about Catholic Health this morning. Let me highlight Chris for everyone.
Where are you, Miss Chris?
Yeah,
I'm right here. You could see me.
Chris, how many
Spotlight
years
you.
do we go back, should we say?
Oh, well, we were only 5 when we met, right? So then we could say.
That sounds great.
Yeah, yeah, Janine, you have been amazing and creating the collaborative out of nothing. Nancy, who's since retired, so good for her. But you know, you and I keep plugging on.
Yeah, we keep waiting for our day, but it never.
Right, someday.
Yeah.
But for now, I'm thank you for spotlighting us. It was very exciting, but because it was so exciting, I wasn't prepared to be there, so I apologize for appearing remotely. But here we are. So, Brooke, are you able to pull up the slides and share those?
Oh, yes, can you see them?
No, I cannot. I don't know if others can.
Yeah.
Oh, maybe.
Yeah,
Screen sharing?
other folks joining virtually, can you see the slides? I'm seeing some nods and some.
Okay, all I see is myself, so that's annoying.
We
can see the slides. We can see them.
All right, well, then I'm gonna have to just trust that, Brooke, you're gonna move them forward for me because I can't see them.
Yes,
So
I definitely will. Sorry about that.
that's all right. I just don't want to look at my big face on my screen. It's a little horrifying. So, okay. So Catholic Health, for those who don't know, is what we call an integrated health system. And by that, we mean it's not just hospitals, it's not just home health, it's not just physician practices, it's everything and anything. We are the largest faith-based employer on Long Island, and we're the third largest employer on Long Island. So hopefully you're seeing the slide that gives you some of the stats about how many physicians we have, our 6 hospitals, our multi-care specialty centers, cancer outpatient centers, and the like. So I'll give you a second to absorb that because there's a bunch of things on that slide.
Just go back for a second.
Yeah, and I see you're opening up more and more specialty practices out.
Yeah. Yeah, and you'll see that I have another slide that really digs down into that. So now if you could show the fast facts slide, a nice gold one.
Yes, we're there.
All right. So you can see, I mean, you know, you don't need me to read the numbers to you, but you can see how impressive they are, right? This is just on an annual basis. And one of the things that we like to say about our health system, and I know this for a fact, I'm here 21 years, and I've interviewed a lot of people over my time, whether they're the housekeeping person or an administrative leader. Everyone across says it's the culture. That's why they work here, because it's not for the money. So it's definitely for the culture, and that they feel that they are part of something bigger than themselves. One woman described it to me as it's something in the air, right? That you feel that once you get here, you're part of something. And this demonstrates, right, that the community recognizes that, and they turn to us in their times of need. So let's go to the Catholic Health Facility Network overview.
There's just a question in the chat asking
sure.
if you could explain the difference between ambulatory.
Oh, yeah.
care and
I
the
see
ER.
that. Yes. Okay. So let's start with the ER. Everybody knows the ER, right? That's an emergency. I'm bleeding. I got shot. I'm having a heart attack. Go to the ER. Don't mess around. Urgent care is, you know, maybe I hurt my arm. I don't know if I broke it. I have a skin on my knee. I might have an ear infection. That's urgent care. So it's something a little bit, you know, it's important to you, but it's not at the level of the ER, and you don't want to sit in an ER for 8 hours, right? The ambulatory care is sort of, we call it a bedless hospital. So it has all the services of a hospital, but at a convenient location where you could just, you see cars behind me, you could just like drive up, pull in, hey, I'm here. In our Center Reach facility, for example, that we just opened, you can enter into a kiosk when you get there. You can walk up to a person if you want, but if you don't, you can enter in a kiosk and then have your details in there, just like CityMD and ProHealth do now. You scan your license, you scan your insurance card, so in and out fast. Then we have imaging there, so radiology. We have colonoscopies, endoscopies. We even have a pharmacy there. We have right adjacent to the building urgent care. So if it needs a higher level, you can slide over to the urgent care. Or if you're in urgent care and you need some follow-up care, you can slide to the left and you're in the other services. So that's kind of the difference of the 3. Hopefully that makes sense.
Thank you for that. I will move to the next slide here.
All right.
Facility network overview.
Yeah, so you can see this kind of gives you the outline of, you know, our multidisciplinary centers, our post-acute care network. That's another category, right? So post-acute care, you've been in the hospital and now you need to recover. Generally tend to be older people or people with extensive orthopedic injuries. But we do have in each of our nursing homes, and we have 3 nursing homes, where you can go into for short-term acute recovery, right? So it's a step down from the hospital into another level of care, but you're not at home. So it gives you a nice transition period. And then home care is they come right to your house and they help you. They also have telemonitoring where they can hook you up with, I said hook you up, that sounds like I'm hooking you up with medical equipment, but it's really, we're giving you a little blood pressure cuff, oxy, you know, so you can test your blood pressure, your pulse, your weight. So for example, if you get on the scale in the morning and you've gained 5 pounds, it's because you had that pizza or Chinese food the night before. You know, you tell the nurse that's what happened, and they don't get in a panic, but they can monitor you remotely. So if you're recovering from open heart surgery, you don't have to go into the doctor's office every day, and we don't have to have someone in your house every day. But if you need it, then they'll immediately be deployed to you because they will see your numbers. And then, of course, we have the standard hospitals, the 6 hospitals. And then we have what we call our specialty tertiary hospitals, meaning they do the higher level of care, like open heart surgery. They do everything except transplant surgery. And we have partners to work with that. So we can set you up and bring you to our partner who will do that level of care. So really the wave going forward, as my hospital colleagues know, is less inpatient and more outpatient. More services, because we have the technology, we have the expertise, can be done locally, and you don't have to go to a hospital. Because you don't want to be in a hospital unless you're having a baby, right? I mean, you know, let's be real. So we're giving you alternatives. We also have telemedicine, where you could do a video visit from your house. And I've used it myself. When I had shingles, but didn't know I had shingles, I thought I got bit by some spider, and, you know, I work in healthcare, but what did I know? So I was able to do a quick video visit and not have to go in. So these are really great options, meaning that you can access healthcare whenever and wherever you need it. So let's move to the next slide. Which one are you looking at now?
Community outreach.
All right. So this is really the nitty gritty. So I talked about all the sort of more of the for-pay services, but we do a lot. Again, this is part of our mission. Yes, there are state requirements to do. As a hospital, you have to give back money into the community. There's the IRS Schedule H-990 we have to fill out to prove that we've done work in the community. But Catholic Health has been doing this long before there were any kind of rules, because it is our mission, right? That is what we do. We believe in bringing healthcare directly into the community to people who need it. And so we have 2, they're 38-foot buses. And just to give you a sense of what that is, that's 8 parking spots long. And we bring teams of nurses right into the communities. They call them select communities, underserved communities. We all know the communities that really need a lot of help, but you'd also be surprised that in communities that you would think would be wealthy, like say a Garden City or a Brightwaters, or, you know, there are also people who need help, and even more so after the pandemic, because people lost their jobs, they took jobs that were lower paying, or maybe their health has been compromised. So in going out, you can see, and we're still going today, my nurses are out in the field right now. They have screened more than 6,000 people directly in their communities. Then in addition to those buses that go out Monday through Friday, we have what our weekend program is called Healthy Sundays. And originally that started with being in the parishes, going right to the churches, because a lot of people who are undocumented don't trust anyone, right? They think we might turn them in, but this is a safe space. So if we have the blessing of the church and we're there, we're accepted. And we've proven ourselves time and time again, because we're not about reporting anyone, we're about helping people. And so through those programs, we've screened another 1,400 people. When we go out into the field, we realize it's not good enough to just do the vaccine and the testing and then try and hook them up with free medication and transportation. We also needed to give them ongoing clinical care. So we opened 2 Bishop McHugh Health Centers. And again, for people who are undocumented, anybody who doesn't have insurance We do low cost, no cost sliding fee. They have to fill out paperwork, and if they're eligible, we can also help enroll them because a lot of people don't realize they're eligible for healthcare. So we help them with the enrollment. So we've been seeing many, many patients for the last 10 plus years at our centers there. We also have at St. Charles a dental clinic. Many people need dental, and a lot of veterans need dental, seniors, kids. So they do an amazing job there. You can see the numbers. We opened, we got a grant from the Cabrini Foundation, and we had our family and children's clinic inside Mercy Hospital, and now it's a freestanding building adjacent to the hospital across from the emergency department in Rockville Center. And we see mothers and children's and family there with all types of services, again, accommodating the needs. And with the Cabrini Foundation, we've reached out for more grant money for these kinds of things. So for example, I have a bilingual social worker, Alexandra Stanton. She comes out with us on the bus, and she does the SDOH, social determinants, social drivers of health, and asks questions of people, helps connect them. She's sort of the Unite Us of our bus, right? Giving them access to resources, making sure they can get medications, making sure they have access to a primary care physician, anything they need. She's helped them with legal issues as well, domestic violence situations. So she has, we have it both electronically and in hard copy that we can help people with our resources, which is probably a lot of you on this meeting. And then we've opened speakers bureaus. You know, we've all had these before, but we've made it really more formalized. If you go to our website, chsli.org, and you type in Speakers Bureau or Community Benefit or Community Outreach, you'll find that page. It talks about all of our events, talks about how you can ask for a speaker, request one for free. They'll come in person or they'll do it virtually. We give a list of sample topics, but if you don't see a topic there, you can invent one and we'll find an expert for you. We have 17,000 employees, so I can probably find somebody. And they're also culturally appropriate. We have people from all backgrounds who speak many different languages, even Urdu, which I really want to hear that because it sounds so interesting. So we have that to offer you as well. So if you can, one other thing I wanted to mention too is some of the other programs we do in outreach is substance abuse prevention. We do Narcan training, we do AC, BLS training, we've done heart health for police officers, maternal monitoring programs, senior health and nutrition. Our hospitals go right into the senior centers, and they'll bring their chef and they'll cook a meal and everybody gets the food. And then we give them oils. This is good. Sam does this. It's wonderful. Bottled oil and spice rubs that they hand out to people. So they not only get the education, they get recipes and they get products that they can use at home, all for free. And then our next slide, right, is the diabetes education. And that's another category. We all know from our community health needs assessments for Long Island that diabetes is highly prevalent. And so we have really got an expert on our team, Lucille Hughes. She's the current president of the American Diabetes Association, and she's, as our president describes her, a firecracker. So she is really a dynamo. She's rang the bell at the stock exchange. She's traveled all over the world talking about it, and she has accredited our diabetes centers across the island. And anybody can call, and again, you can check on our website for this, to get a free assessment. And then she'll work with them to make sure if they have insurance, don't have insurance, or do have insurance, we also help people who are insured, that they can get access to the care that they need. So that's kind of us in a nutshell. Happy to answer any questions or add any more information that people would like.
I don't know, I think that was one of the best summaries of what you do again, what Catholic Health is doing, and I've heard in a long time. And you have a question?
I did have one question. First of all, thank you so much for sharing this presentation. It was really informative and very helpful to understanding how you're meeting your mission. I noticed on the map there wasn't as much on the eastern Suffolk.
Yes.
And I was just curious if you were looking to expand and provide services in that area. There's many underserved people in that region that may need more support.
Yeah, you're wonderful. I forgot to mention that. And so thank you. It's like you're my shill in the audience because we're opening we're opening a new ambulatory care center in Riverhead. And that I think it's going to be January 24th that we're opening it. So we're bringing out our bus. We're going to all the areas because prior to that, our closest hospital is St. Charles Hospital. And that's pretty hard, right? That's a pretty good distance. So having this ambulatory care center, remember that's like the bedless hospital. So it's going to have radiology, cardiology, diabetes, all kinds of information and services right there in the community. So by the end of January, we will have it present in your community. I think it's 800 Main Street in Riverhead, if you know that area, not too far from Town Hall, about 1.5 miles from Town Hall.
Excellent. That's wonderful. Thank you.
Yeah, thank you for asking the question.
Anyone else have any questions? Well, thank you, Chris. I believe you have to run to another meeting.
Yes, thank you so much. I appreciate it, Janine.
Sure. Thank you.
All right, bye.
Bye. We're gonna switch now to talk about core cluster updates. And core clusters are really just another name that I have given work groups, and I've given it the name core cluster because work groups has a bit of a negative connotation. I don't want people to think that they have to work, but we call them core clusters. And we're going to skip to Annalise's, which one?
Yeah, we're gonna start with our chronic disease cluster. Annalia Trask is going to give us a little update.
Because she has to also run by 10:30.
We're gonna spotlight her so everyone can see her.
There she is.
Hi, thank you, Brooke and Janine. So the chronic disease core cluster has met a couple of times, and we have put our heads together from all of our different fields working in different chronic diseases. I myself work for the Stony Brook Cancer Center, but we have representation from epilepsy, diabetes, and other chronic diseases. So we said, what can we all do to put all of that together? So our focus is going to be creating a resource guide for strategies to manage chronic disease and manage health in general, so primary care, things like that. And we're going to gear this towards young people and young adults, specifically those who are transitioning from adolescence into adulthood, who are taking an active role in their healthcare for the first time in their life. Maybe they're still on their parents' insurance and need to learn how to, have their insurance information, call their insurance provider, pay their medical bills on their own. Maybe they're approaching the age of 26 and need to find their own health insurance, and then find resources within their insurance, or if they're not insured, resources for the uninsured to help them manage their chronic diseases, as well as seek primary care regularly and preventative care, screenings and the like, to maintain health and prevent chronic disease going forward. So we're very excited, and we hope to put together a resource guide of different resources so that if someone is, they're just interested in looking up information on general health literacy, that's available. But maybe this is a young person with diabetes, there might be specific workshops such as what, Catholic Health is offering at their programs, and things like that are more specific to the existing chronic disease. But we also want to focus on preventative care and general health care to prevent chronic disease.
Right, and that aligns with the priority that the group has chosen collectively based upon all the data that we look at every 3 years as a comprehensive community health needs assessment. Chronic disease and mental health always rise to the top. And focusing on that very specific group, that group of high school to 25-year-olds or so, it's there's a gap there, right? Many of them don't understand how to use their insurance, don't know that they perhaps, don't know what's available, that there's preventative services, right? Annual checkups and certain vaccines that they're entitled to. So we felt that was, which we want to come out of this, and I told this to all of the core clusters, with a concrete work product, right? I just don't want a me to meet. we want to have something, and I think the way we're working it right now is these, it will be like a landing page on the collaborative site that will be under our chronic disease, live better kind of campaign, or that section someplace, where there's a list of services with a lot of hyperlinks, right? Because we can't be all the end all to everybody. We can't do it all. There's so much out there, and there's so many organizations working in the area of chronic disease, which is broad, right? Even some of the cancers now are chronic diseases. So,
Yeah.
you know, we're gonna try and do that as best we can and have that available, and then push it out to the public, to the media, give credit to those organizations on the cluster, and then, of course, extend that credit out to the whole collaborative, that this is a product that was designed and supported and produced by these organizations, and then meeting the state's requirements to speak to a priority on the prevention agenda. So that's how it kind of all ties together. So does anybody have any questions for Analia? No?
Thank you so much for giving the update.
Thank you.
Thank you, Analia.
Alrighty, so Nadine, would you like to give our mental health cluster update?
Sure. So the mental health cluster has met twice. I was only in that second meeting, so gonna, this is a very brief overview, but we have Jennifer and Irene from Epic Foundation, Alan Higgins, who's here as well, so you can chime in, and Karen Beck from the Association of Mental Health and Wellness, and these lovely ladies overseeing and helping us out. So really we were in a insights and curiosity phase still in our meeting, which is really exploring the intention of the cluster, what could we feasibly do, and what would the impact of that look like. We had a discussion on value-based initiatives, so what would be valuable for the whole collaborative to gain from, versus whether this is a community impact initiative. So we were really trying to figure out who should be the recipient of the value. And then we explored, just the impact of the collaborative as a whole and contributing to what the other clusters are doing, so that we can have sort of an exponential impact, and whether that was related. So really in the idea development phase, and we had some conversations also on target population and highest need areas, and we're all coming from different places, so that was a really kind of robust discussion too. So I would say I'm just sharing our ideations at the moment, and that's the phase that our group is in, and we were also sort of seeking who else we can speak to, and whether we really need to do a little bit a deeper dive into a needs assessment.
Right, and I think we also talked about, if I remember correctly, maybe embracing some kind of a policy change that we would suggest. I don't know to whom we would suggest it, but maybe legislators or suggested, suggested policies, whatever, at different levels.
That would be researching, some legislation that might be timely before our next meeting, that we might be able to pull into some of the work that we want to do.
Right, particularly like telehealth, mental health services delivered via telehealth. I have to do some research on this, but I understand that at least on the Medicare side, those restrictions on telehealth have been extended, I think, through next year. Don't hold me to that. But on the state and federal level, right, telehealth has been a great way, and the literature it provides us evidence for this, has been a fantastic way to reach and help people, right? Particularly as we've been going through the pandemic, but even now after the pandemic, and we've seen it's a very viable way to provide mental health services. So I was going to kind of compile on the state and federal level what's in the hopper right now. Also, workforce. We talked about the need that we need behavioral health providers of all sorts. And I know on the federal level, there are some proposed pieces of legislation to help that. And I have to go through it and pull it together. And so I have it for everyone in a very easy to understand, kind of, here's the bill, here's a quick summary, here's where it's at. Some of them die, some of them just sit in committee, some of them, but, and maybe go so far as a collaborative to write a letter of support. I'm not sure, right? So that would be a tangible product that we would have at the end of this. But we are still talking about a lot of ideas, but that was kind of the way we go. And Nadine, her organization, Mind the Class.
Mind Arch Health, right?
We've changed
Mind
names.
the Class.
It was Mind the Class, now it's Mind Arc Health.
Mind Our Health.
Mind Arc.
Arc.
Mind Arc
Sorry.
Health?
Yes. Mind Arc Health. Yeah.
Okay. Nadine is like a fascinating person, and one day I'm gonna sit down and speak to her one-on-one. But she has, you've had some international success. You've published international?
Stop. Yeah, we don't have to go into all that right now.
But no, and you know, I was having trouble at first really understanding what your mission was. And she says that there's certain risk factors or indicators that, and with children, right, that crop up. And I think what you're doing is intervening when you see those. And I'm not sure if it's programming but it's academically related too. Yeah. She's published papers. She's
just starting. You're giving me way too much credit.
If you went on her website, you would see. There's some international association that's well known. That's putting in place what your evidence-based.
They're not doing anything with it besides they publish our initial study, but it's OECD, which is
OECD.
OECD,
the Office of Economic and
Development, and the division is OPSI, which is a public service sector innovations, which it just, they have a lot of case studies on their case study library.
I know, but to have your case study on there, I think is pretty good.
Yes, thank you so much.
So she impresses me, I guess that's what I'm trying to say, and I would love to learn more about what she does.
Offer a suggestion.
Yeah.
Just from our own, because Cleo heads our lung program at Peconic Bay in the Northwell. And what we've found, which is quite interesting, is that out of all the cancers that we represent, lung is not so supported, as we know. Unfortunately, even though it is the #1 top killer of all the cancers combined, lung is #1, but there's not a lot of speak about it. So what we found is a lot of people, the low screening rate is due to personal guilt, shame. They don't want to know because they've done this to themselves. And it's all a mental thing. And it's not a lot of services that are offered for mental health for the person going to get that screening. Taking off that guilt, doing something with that so that they feel not so like, this is my fault.
Yeah.
I don't want to know that I've done this to myself. What am I going to do? With my family because I've done this to myself, like I've, created all these things. And then once they go to get the screening, the waiting period, that mental toll of waiting for the results.
Oh yeah, that's where the anxiety gets
Right.
in.
And then having to deal with the results when they come, if it's something, terrible, God forbid. But those services are non-existent.
And
So I
so
think-
incredibly important.
Right,
You're
so
saying,
I
that
think
you
that
have a drop off.
that mental piece is
Right.
missing.
You have a drop off of people not
Yeah.
following up because
They feel
they
feel
get caught up.
it's their fault.
There's a lot of research on that. They call it the liminal space.
Yeah,
where
but
you're
there's
stuck
nothing's
in that
being
space.
done
They
with
call
it.
it the
The
limited.
liminal space where you feel
Liminal.
you can't go anywhere.
Mhm.
And so the shame and you just feel that nobody empathizes with your
Yeah,
situation.
because,
Yeah.
And then it's also that implication that as soon as, you say, I have lung cancer, well, you were a smoker. It's
Right.
automatically tied to smoking, even though people can get lung cancer that have never smoked.
And
Or
before they
you're a
did, so what?
secondhand
Yeah.
person, your
Right.
spouse has done it.
Yeah.
And you just were around and you got lung cancer as a result, unfortunately.
Right.
So I think that mental health component is so necessary. And it's so like, I can't even believe like it's 2023 and it's still nothing. And there's no support services, like even for AA, they have Algernon, you know, like Al-Anon, excuse me, where they have the spousal support for the person going, but they have nothing for tobacco use or secondhand smoke individuals who have gained lung cancer. There's nothing, because honestly, that person has gained, you know, a illness that, you know, could be fatal by no doing of their own. It's just a lot of mental pieces missing. And there's no support there. And so I think that would be interesting to explore, you know, just a suggestion.
So no, not even any support groups that you know, like the American Lung
They have very
Association?
few.
Very little.
New York
Very
State
little.
Quits actually provides a chatting 24/7.
But that's like to help you quit.
To help you quit once you decide, and they'll also provide you with whatever you need, like the patches, the lozenges, you know, all these things and everything. Most of the hospitals are only for Norfolk, I can speak. The smoking cessation group meets only once a week, and it's every Tuesday, and it's from 5 to 6.
That's for
Of
smoking
which-
cessation,
Yeah.
that's not for people who've been screened and now.
No, but even without the screening, there's people that are trying to quit before the screening, trying to get them into the screening is actually going to deal with taking accountability of, well,
even to
actually
get into-
admitting to the fact that it's a disease and it's an addiction, which is what American Lung Cancer Association is trying to do. They're trying to remove the taboo and make it known and acceptable that it's an addiction and it's a disease. But, you know, for a smoker, it's very difficult to understand that and accept that, because you know what? No one put that cigarette in your mouth except you did.
You did, right.
So that's the barrier, one of the biggest, the strongest barriers that we have right now.
So that's a whole
Yeah, I think
psychology,
it's just
there's a whole
something to look at.
psychology behind that. If we don't have enough mental health, behavioral health workers to begin with, this is just another burden, another niche to fill.
And it's so like brushed over.
Yeah.
Even like learning your triggers as to why you smoke. Because I mean, it's a fact that people who are dealing with mental illness have a high rate of smoking.
That's true.
Yeah.
A very high rate of
I'm a
smoking.
COPD educator, so.
Yeah.
Yeah.
Come on.
Yes, I'm coming to talk to you now.
So it's like, because even I worked in mental health for 7 years and all of my patients smoked, all of them. You know, even if they say, oh, like I don't
Well, it's
smoke,
a
and then you
coping
see them
mechanism.
outside, you know, there's no need to lie to me, but you know, whatever. Like, it's part of
It's a
their.
coping mechanism, and so
Right.
it goes back to understanding the psychology of addiction. What you have to do to convince somebody to change a behavior. Behavior change is one of the most difficult.
Yes,
And
it
that's
is.
really what this is all about, right? Getting people to adopt better behaviors, like change lifestyle. Eat better, exercise, whatever it might be, stop smoking.
Yeah.
Easy to say.
Hard,
Dr.
very
Guerrier
difficult
was
to do.
here,
Yeah.
she probably tells her patients to do that. I think she has a little more compassion, she seems to be a little more tuned in. But other than telling someone, you know, go to a smoking cessation program or join Weight Watchers or join a walking program, whether that actually translates into action, that then is the whole.
Yeah.
And health educators study this, right? You know, what theories and models can we use to move a person from thinking about on a contemplation stage to the next stage, to the action stage, and then to sustain the behavior. It's tough.
We have a hand raised. Naheed, did you want to add to that?
Hi, first of all, thank you so much for arranging these meetings every time. It's something new that we learn, and I apologize I couldn't be there because I am back to back in meetings. I upload 2 documents because this is all about mental health and also specialties. I asked Minad, and I think he's there. He's a grant director. So if you can go over these 2 things, that would be great.
And Naheed, you're with NASA
Keasha Community College, yes.
And the community health worker is one of the programs that I know
Yes.
So you put documents in the chat, is that what you're
Yes.
telling?
Yes.
Yes?
Yeah.
I think it would be interesting to see it. I just want to see it, you know? Before I'm laid to rest, I'd like to see something.
I
you know?
understand.
Specialties or which document?
So I uploaded, one is mental health and one is specialties. So it's with what you were talking about. So that's why I wanted everyone to see it, and we want to hear everyone's opinion, comments, if they want us to maybe improve these. But Minat can better represent these two. I just want to introduce Dr. Khan. I'm the current acting Dean for Workforce Development at Nassau Community College, and we created community health worker program 5-6 years ago.
Yeah.
And then upon Northwell request, we created community mental health worker program, which we ran. The second cohort is going to be graduating in 2 months. And we've also created a second step for community health workers with specialties, chronic diseases, and the other one is maternal and infant health. So Minat, if you can go over.
Well,
I'd love to hear more about this.
representation is here from Nassau Community College.
I know, I mean, yeah, but you should join our mental health cluster.
Oh, you mean the cluster, right?
Yeah.
You should join the cluster, yes. Now, these community mental health workers, after they're trained, would they be a cohort of behavioral health providers who could assist in a situation or provide some assistance in a situation that my colleague here was talking about, where a person goes for screening or is afraid to go for screening or does go for the screening and then is in that period of anxiety waiting to see, like, is that maybe community health, maybe you could have community health workers placed
Yeah.
from
That would
your
be great.
institutions working on just that kind of specific
Yeah.
issue and study it and
I think that would
put
be great.
something,
Yes, and we would
a
love to do
pilot in
that.
place or something.
Yeah, I think that would be great, because that would be a
Yeah.
nice component, it'd be like a nice one-on-one kind of
Yeah.
personable
Yes.
thing. What do you think?
Do you go to Suffolk? Because I see that this is Nassau. So we're only in Suffolk that we're,
I mean, granted,
We don't have-
the problem is everywhere, though.
it is
Yes.
everywhere, but I'm
Yes.
saying,
And we do have students from Suffolk as well. The advantage of this program is it takes that community health worker training and understanding of the field and everything, and it adds the mental health component to it. So they have that mental health understanding and trained in everything a CHW is trained with, plus the mental health. So I think working together on this is going to be very beneficial
definitely.
Oh, I'm
for
excited.
everyone.
This is, wonder why is the collaborative in place? Well, oftentimes we see relationships develop organically at these meetings, and here we're seeing it right before our eyes.
Beautiful, isn't it?
Right, one, and now, whether, we'll see what comes of it, I don't know. Because even my question sometimes, oh, well, we're gonna have another meeting, people are sick of going to meetings. I always try to make these meetings meaningful. You walk away with something, and I'm so happy to see this, and this just happened, right? That she happened to mention this, and he's here, and you said what you said, and it all stemmed from Nadine talking about the mental health cluster, and, so, that's networking at its best.
Yes, it is.
That's it.
Are we gonna be able to share these documents with everybody?
Oh, awesome.
Yeah.
Yep.
Yeah, we'll link that.
I can send everyone
Yeah.
these documents, and we're always working on improving the programs to address the needs of the organizations and the communities. For this ongoing cohort, we added the NAMI provider training to help with communication. And we're always looking to improve. So if that's something we can add to the program, we're gonna be more than happy to work on something and build it into the program itself.
But you have field placements too, right?
We do.
Students who go, you could be placed
Yeah,
to work.
Yes.
and we can also do the training for lung. So that way, when they, they know the specifics and everything like that, in order like to deal with all the ins and outs of what the screening entails and
How to
the
connect them to
doses
a
of the
s-
CT
right, yeah.
scan and all that other stuff, so, yeah, so we can do that.
So you kind of Disneyfy the experience for them.
Yeah.
Where they feel that connection,
Lost it all.
where they can let go a little bit of the shame.
Yeah.
Yeah,
Did you
that's
say Disney?
Disneyfy it.
I
Yeah,
really think
that's
that-
yeah. So with that hypervigilance that people
Yeah.
feel,
Yeah,
when
it's
they
they're
feel so shamed
anxious.
about their situation, everything is wrong when they have that encounter. That encounter is threatening.
Yeah.
Because they know somebody is already judging them. So I coach people dress for success. Dress as you're there to earn, they're earning your trust. You have to kind of switch it.
Yeah.
But
Yeah,
if you,
put the power in their
instead of saying, oh, yeah, you're gonna have to do that, you've been a smoker, where somebody sits there and says, this is our first step, I'm here to hold your hand through this, 2-finger point, let me show you where to go, it's not threatening.
Yeah.
And healthcare workers are threatening because they have all the knowledge. I'm sorry, let me clarify.
I get it.
Physicians and nurse
Intimidating.
practitioners are intimidating, whereas a community healthcare worker is more of a partner.
Yeah.
Does that make sense?
Yeah.
And it's sort of, it's sort of like you're a member of their, like,
Yeah.
you're on equal ground.
Yeah,
I
less-
love the idea,
less
and I think it's a
intimidating.
Yeah.
it's a great model. And it doesn't necessarily have to be in person all the time either, because sometimes the wall of the telehealth connection, of the electronic connection helps them a little bit.
Yeah, because
Talk to each other.
believe it or not, like I have another job. And so I do a lot of phone calls and I swear I learned everything about people's personal lives.
Yeah.
Through the phone.
Yeah.
And I'm like, I'm never gonna meet you, but I feel like I know the grandkids' names, what they want for Christmas, everything.
Yeah.
Just because I picked up the phone that day. So people can be more laxed in a setting that is not face to face because that it's like intimidating and you
Yeah.
kind of feel like a little
they make you get
shy,
psyched up
you gotta
for it.
take, little baby steps, whereas over the phone, you kind of just blurt everything all out and
Yeah.
kind of takes a little bit of that intimidation away.
Yeah. I love what you're thinking.
Yeah.
So excited.
Yeah.
Great.
Yeah.
All right.
Oh, we have a question.
Oh, another question.
I have a question. Hi, my name is Tan. I work for Outreach New York. We're based out on Long Island, specifically within Nassau, Suffolk counties, as well as Queens and Brooklyn. I am a mental health and substance abuse provider, also providing education and training, adjunct professor of population health for Hofstra University.
Nice.
I would like to join the mental health cluster if I can. I also have some
Yay.
ideas. My agency provides a lot of in-person, hybrid, and virtual services as well as bilingual services. So I'm happy to connect anyone. You need students or like interns. I'm happy to connect as well. But
Okay.
just wanted to.
Good, you're on.
Yeah, and I have
I have
connections with the
yeah.
COPD Foundation too, so I
Okay.
can.
Okay.
And I brought information with
Excellent.
me.
See
so I can
this?
give it.
Yes,
Look at this synergy.
Yeah. We should have did this a long time ago. Talk about the success of it.
So like my organization provides support groups, maybe not like specialized towards like smoking, more towards like
I'm very
AA.
familiar with
But
you
we
guys.
do, yeah, but
love
we
you
do
guys.
have like group and individual counseling as well as it's appropriate, so.
Excellent.
Yeah.
Wow.
Wonderful.
Any other questions virtually? Anybody's hand raised?
And then we just have, I hate to like cut off this organic synergy. We just have one other cluster update to give. Is there anyone from the CCHL cluster on that would be willing to give an update? That's one way to drop it off. That's okay, I can give an update.
Which is cultural, cultural competency, health literacy, that's what CCHL stands for.
Yeah, so we've met twice. All of these clusters have only met twice, so please don't feel like it's too late for you to join. If you want to participate, just send me an email. We would love to have you. So we've been kind of examining our previous CCHL program that the Long Island Health Collaborative had in place some years ago. And we've talked about moving forward, kind of adopting the class standards for our new model that we would like to have on our website that would be, we're thinking maybe like an hour course that folks can take and get a certificate. And what else did we talk about in
Yeah,
our
so-
CCHL cluster?
So we want to do some research to find if there are certification programs already, which they probably are, out there. And so we have a cluster member who's working on that, is going to report back. But even if that's the case, we might be able to, because we are Long Island, make it regionalized or specific in some way. And I'm just thinking web-based, somebody goes in, it's portal. You know those class standards, I think there are 15 of them. Maybe couple of questions at the end. And the bit of that is, so anybody in the institution can do that. They have gotten this kind of refresher or this certification, whatever we want to call it. We haven't worked out the details. And it's another way to show how proactive your institution is in terms of health equity and inclusion. And maybe if you're writing grants, you can say, 90% of our staff have gone through this this training program. And I don't want to call it a training program, because it's nothing that involved. It's like a web-based, easy to do.
Like a 101 type of.
Yeah. So that's what we were thinking, and that's a tangible product that everybody could avail themselves of. And again, cluster that works on it being given the credit for doing that, but then tangentially everyone who's involved in the collaborative, because we all have input, we come together and we talk about this, we take credit for our regional efforts. And our regional efforts, if you look at the state prevention.
Okay.
Look at our state prevention agenda dashboard, they have all kinds of measures, right? Obesity measures, mental health measures, and some they want to go up, some they want to go down, some are going in the wrong direction, some are going in the right direction, some are here. So that, I always tell everyone, collectively, the little bit that we do, each of us, we are contributing to that prevention agenda, to moving the needle there. Same thing with 2030 healthy people. Right? We're not going to here meet the state, like the state wants to decrease something by 2%. We're not going to accomplish that. But our efforts collectively, right, that collective impact model with all other organizations in the state can help move it in that direction. And I try to take comfort from that. And it's kind of like my pep talk to everyone. And I suggest that you all take comfort for that, because we kind of do get stuck in our own little cluster bubble, not cluster bubbles, our own little bubbles, right? Where we work, our employer is our first obligation is to our employer. Because we're all here voluntarily, and our specific area that we work in, whether it's mental health or sexual health or maternal health, we get in a little cluster. But when you start to poke your fingers out of those little bubbles, you do see that there's overlap and intersection. And even though you might come here and you say, well, that's not directly related to me or helping me, in the broadest sense, it is, right? Because chronic disease is broad. Mental health is broad. Those who have postpartum depression are suffering from mental health, probably have some chronic disease too. Kids who are needing sexual health education and are maybe getting involved in situations they shouldn't, have some stress. Persons who needs to get screened or has some stress and worry and mental health issues. And they all kind of intersect. Does that make sense?
Yeah.
Yes.
And one thing I want to say about the clusters is I don't want anyone to feel inundated. Brooke and I are here to do the lion's share of the work as best we can.
Look at Brooke's face.
She's like, yeah, this is just, I remind everyone that this is just a small sliver of our responsibilities. When we had grant funding, we were able to have a bigger staff and do more, but since then, the Nassau Suffolk Hospital Council has been kind enough to support the continuance of this local collaborative infrastructure that's been put in place because we see the importance of it. So I don't want anyone to feel inundated and like, because oftentimes you get on a call with a subgroup and it's like nobody says anything, you ask for input, nobody does anything. So we try to move everybody along as best we can and assure you that we're going to be in the background doing a good amount of the work, but you guys are the experts, not us, about your subject matter. So I just always want to caution everyone. That's why I call it a cluster. I call it a cluster, and I don't call it a work group. It's not a work group, even though it kind of is. So I just wanted to make that clear.
So anyone who wants to join a cluster, just email me.
Or if you want to have an open discussion a little bit more about this approach, and I put this approach in place. I don't know, when did I do it? Prior.
Initial clusters were like
Was
17, right?
It was before pandemic.
Before
This
me
is the
too, so.
It was the before time.
Yeah.
The before time that I had this brainstorm and I scribbled the whole structure out on a whiteboard. I went crazy, I'm in my manic states and actually have a collective from a collective impact model, and I actually wrote a paper or
a think tank
report on it, and how I envisioned that they would work. But it's on our site if anybody's interested in reading it. But anyway, that's the genesis of the cluster model. I'm going to shut up now.
So that's our clusters. And then we just wanted to bring your attention back to the community health assessment survey at today's meeting. We really are trying to do one big final push now that the end of the year is fast approaching. We do have our distribution toolkit, which is accessible via Google Drive. It has paper copies of the surveys you can print and bring with you to, in-person events. We have links and signs that folks can scan with their phone to take the survey on their phone, and other resources for you to share the survey. So we would really just appreciate your partnership in that final push.
Yeah, and so let me just talk a little bit about the community health assessment survey. Most of you, I'm sure, are aware of it, but some of you who may not be aware of it. So this was the beginnings of the Long Island Health Collaborative back in 2013, when the state health department really urged the county health departments and the hospitals in the counties. You're nodding your head, right? You know this. To work together collaboratively on joint community health needs assessment, because you're catering to the same individuals, the same communities, and it made sense, right? So because Nassau Suffolk Hospital Council, our function is to represent hospitals, right? We're lobbyists. That's our main function. We're meeting with all levels of legislators and regulators to ensure that there's reasonable and rational legislation and regulation for hospitals. You can imagine the task that is. So we straddle both counties, and it's like, oh, you're kind of like a neutral coordinating body to do this. And they said to me, can you pull that together? Because way back then, it fell under the community health and marketing department to write these community health, to produce these community health needs assessments, and then write what's called for the hospital a community service plan, and for a county a community health improvement plan. That's who it fell to. And me as a communications person, fell to me to do that. So I did, after some weeks and months, got everyone together, got some community-based organizations via Eileen together, and we drew from some evidence-based questions. There was a survey that both the counties had been sending out separately. We kind of melded the two, and we came up with community health assessment survey. We had epidemiologists working with us, and it was agreed upon by consensus that this was a good tool to send out a survey to. It was front and back, 2 pages, by Sarah Logan. In all honesty, that's my daughter. Yeah, somehow she's in health policy. I don't know how. And communications. She has to go to another meeting. So we developed it, and everybody was happy, and we deployed it. Didn't get that many responses the first time around. It was done through SurveyMonkey. I got the responses back. I did the analysis of these basic questions that came back. Well, the collaborative, they wanted to keep meeting because we put this great infrastructure in place, and I was like, well, we should keep meeting, because I thought that would be the end of it. And that's when we called ourselves the Long Island Health Collaborative. I was able to get a state grant for 5 years, was able to become more sophisticated in our data collection efforts, et cetera, write the a template, CSP and CHIP for the region that hospitals and counties can use or not use, part of it, some of it, whatever. So my point being, we depend upon, so this is convenience sampling, right? So we depend upon partners like all of you. If you're holding an event or you have a community newsletter, and you can pop the link in with some blurbed copy about it, which I think
We have a blurb in the toolkit as well.
We're trying to make it as simple as possible. Of course, we use social media, but social media is not the be all and end all, right? If you don't have that many followers, it's not really going too far. So here's my plug to please ask everyone, because certainly during the pandemic, it was difficult, right? Because nobody was really meeting, nobody was holding programs, everything was virtual. We still managed to gather responses. But my fear is that we're not getting enough responses in, and I don't want to affect the integrity or the validity of the data that's being collected. It is age adjusted, so, and we do give it to a data analyst who takes all the data now and analyzes it and puts it into a Power Pivot Excel program that you can go in and manipulate it and make whatever reports you want. But oftentimes we see those communities, I know in Hempstead, right? If aside from us being able to knock on doors and say, will you please take this to survey, or renting mobile lists and sending texts out with the link, which even that, is not a lot of people just say, what is this? And they just ignore it. It's been very hard to get, and if we don't know what the community is thinking, and if we don't have adequate representation, particularly from some of those select low resource communities, right? We're targeting a lot of what we have to do. It becomes hard for us to justify what we need to do. So this is my kind of year-end push. We've been pushing it every which way we can. When I go to the walks, I run around with the survey. Please take this survey. Some do, some look, some they take it. I said, you can even take a picture. Here's the QR code. You can do it at your convenience. We make it as simple as possible. So that's my plea, that if you value what the community is thinking, and you should, and then all these results are available to you publicly. You can go in and pull down any report. You even customize a report for yourself based on zip code, based on gender, based, some demographics are in there. We've got some social determinant of health questions in there. You can have your own customized report used for program allocation decisions, grants that you might be writing, whatever it might be. So that's my push.
Janelle, I have a question. Has it ever been discussed about, could the hospitals and healthcare organizations integrate the survey in a message blast in their portal, so that you can complete the survey in your health portal?
You mean in the EHR?
Yeah, I get NYU lingo and stuff all the time. I can't tell you how many times I've just completed a survey because it was so convenient. I don't know if that was ever.
You mean in the EHR, sir? I'm not.
Well,
Is
so
it
when
medical record
it
or-
goes through, it's through the greater EHR program, but my
Oh,
chart, yeah.
My chart.
Yeah, there's my chart, there's every
Patient
healthcare
portal.
organization
Patient
has it.
portal, yeah, patient portal.
And through messaging
Yeah.
in iChart, you can send out, a link to
Okay.
or you can actually just, it opens right up into the survey.
Well, right, well, that would be
I know.
dependent upon the willingness.
Whether the
of
willingness. Yeah.
Of the
I'm just curious if that might
organization, and
be a long-term plan to resurrect
Right,
it so
it's
that
it's
it
a
could
good,
be.
it's a good idea,
Yeah.
and it would be dependent upon each hospital, each system. But think about, they themselves have to send out surveys for HCAHPS. So
Right.
now, we don't wanna survey people to
To
death.
death, yeah.
And so we are competing now, right, in a
Yeah.
way, and
It's so scary.
their first obligation is to get the HCAHPS out, right, because they have some reimbursement tied to that. So, the results, right, that come back and where they land. So it's an idea, that's why we kind of default, well, if you have a waiting room, can you put copies out in your waiting room? All of those Catholic health facilities, if they could just put a stack out, and then you can send them directly back to us, and we do all the inputting.
Right.
Right, we take care of it from this end. Ideally, we have a QR code, and that's the better way to do it. And it's easy for the person too. But that's an idea, I'd have to probably talk to our council board, which is comprised of the CEOs of every hospital, and,
I see the fatigue of having to do multiple.
I'm not gonna say that would be an easy lift.
Yeah.
Come on, that might, yep. And if Chris was still here, she would say the same thing, trust me, but it's an idea, right? So I'd like to rent lists for those communities and just, send out and see what happens. Money, I have no funding to do anything.
I also think that you could start somewhere where people are already engaged with those that are present, like the Healthy Sundays, like Chris
Yes,
mentioned. that Catholic
yes.
Health. So it takes effort to show up to any meeting.
Yes.
Or show up to an event where you're looking to improve your health.
Yeah.
Seek a screening test of your own. So maybe
Right.
while we have their attention at a booth like that, that's where some marketing collateral, a QR code to a survey
Yeah.
could be beneficial.
And we do that, but again, it's dependent upon
Fatigue and
not only
Over-survey.
fatigue, but Chris is not there. She had to make sure that the people deployed understand that, please make sure this survey is available, try and get people to fill it, or to take a picture of the QR code. So that's why I'm saying, all those avenues work to an extent. Short of me being able to rent lists for Hempstead and say Wyandanch and Freeport, all the communities that we hear about all the time that are under-resourced, to hear really, because we want to hear from the individuals who are suffering. They're the ones.
Right.
That's who you want to hear from.
So
That's my dream.
some events that I've been to have like an iPad that's like stationary, and then they'll participants like complete like the
Yeah.
survey, like either when they enter to like sign
Yeah.
in or to
When they
leave.
leave,
Yeah, so maybe that's like something to play off your idea.
Yeah.
Yeah,
Well,
reducing friction and reducing the barriers
Right.
to just completing it, making it as simple as possible.
Right.
It's
Right.
always the easiest path forward.
Right, so it's Brooke and I, we cannot possibly go to every event on Long Island.
Wish we could.
Wish we could. We do have an iPad. We've actually used it in the past and we did not have success with it. People didn't want to be bothered answering on the iPad.
What about giving it to the community health workers that go out in the field? Giving them iPads and having them ask, because it would go along with their assessment of the patient's needs.
The DSHRP program did that, the Delivery System Reform Incentive Payment Program, when they were trying to increase patient engagement. They had, I guess, community health workers, I don't know who they were, would go and, I don't know where they were meeting with people, but they would stand with them and go through with the iPad and get, and have the questions answered. I don't know what happened with that data or if it was successful or whatnot.
Janine, we used to do that, our community health workers, we go to a lot of outreach events. And again, in the before times, we used to take the surveys. And we also took the surveys to our individual clients. But I think just over time, kind of lost the thread. So
yeah,
going forward, I will make sure that all of our workers have these.
Yes.
I don't know about the high-tech iPads and things, but
No,
we'll
but
certainly print them out.
Yeah, we're
and-
happy to enter those.
and
However,
give 'em
if
out.
someone wants to take the survey,
and
it works
even
for us.
even we have a description and a QR code for some savvier individuals who don't want to sit there and fill it out. They could take a picture of the QR code and fill it out that way at their leisure.
I can also see whether we can put that on our website.
Yeah, on the websites, yeah. And again, we have all the descriptive, like if you have a community newsletter, I think we've written some copy that you could just, and then you can customize the copy and say, for instance, Nassau Community College is a participant in the Long Island Health Collaborative, and we understand the importance of wanting to know what your needs are, and so then that gives you some, you can do that way, that gives you play then.
Just
So we
add it
tried
all
to,
together, because everybody's gonna do a little piece, like
Yeah.
we're gonna hit some of the high need communities.
Yeah.
But we're probably gonna, see more of the pregnant postpartum.
right, so you're gonna
certain-
get, right,
But you add that into everybody's.
right, so we wanna get a
Arena.
diversity of responses
Right, and
too,
then
right?
Just collect.
So you're probably gonna get, well, I don't know, young people don't wanna fill anything out, but if you give them a QR code, they might.
I may be able to get also the teachers, the
The
social workers.
teachers, right, and they can speak on the behalf, because that survey is individual perception of health and health barriers, and then what is your perception of your community's health, need for health and the health barriers that you face, so
it's quick too.
and we kept it to the front, and it is pretty quick, and then there's some demographic information, only because we need the zip code, so we can do zip code analysis, and we need male, female, gender, race, all that stuff. I think we asked a question about broadband access.
Yeah, now we do.
Which I don't even know why we're asking here on Long Island, we have pretty extensive coverage, but why,
A lot of people cut their service.
yeah, a lot, but the group wanted that, see,
Right.
anything we do, it has to be group consensus, like, we can't say we're gonna make a change. We have to bring it to the group. But a lot of senior centers, they'll distribute it, but now we're getting just that senior population. So that's why we do age adjusting.
I have a question then. So we can just get the printouts and have them completed and then mail them back to you?
Yeah.
Exactly.
Because in the evenings, I'm an ESL teacher. So my demographics are very either
Yeah.
Central, South American or Haitian.
Yeah.
So just print them out, have them to do it as to do now. That way they can complete the service and then just mail them back to you.
That's right, you have to do nothing, and then we enter.
Okay.
Sometimes we do like a marathon, we have a pile like this and we split it up. I mean, it's not the ideal way to do it, because it's better if it's done electronically and but if we have to, we have to. I mean, so I'm hearing that at the start of the year, I'm gonna send everyone a big thick packet.
That's it.
There you go.
Question,
That's what I'm gonna do
before the end of the year.
Is it translated into Haitian Creole? We have it in Spanish right now,
Yes, it has Haitian, is Haitian
not the
Creole.
updated version. We can get that done.
Oh, well, we have a Spanish and English version, but I thought we had, and we also
The
have.
previous version, we did have Haitian Creole, but not after we
We made
revised
some,
some of the
all right, so we
questions.
have to just get this, so we have Haitian
Okay.
Creole, I think we have Polish. Like, we went by the top, we looked at the top languages.
Ukrainian?
I don't know if it's, I'd have to look.
Right now, it is only Spanish and English for the updated version. So the Haitian Creole and any other suggestions you have,
There were
definitely
like 4 different languages.
for the initial version.
I think it's in Arabic, I don't know, I'd have to look, we can't,
Not this updated version.
not the updated version, but we do say that it's
Very much
available. So we just have to have that updated, so we
We have
just
a
send it
Polish
to the.
time, just have to get them translated.
Yeah, so that's So that's what I wanted to talk about with that. And right, we can too, right? We boost on social media. We have, you'll send everybody a link to the toolkit,
Yeah,
right?
so the
It's
toolkit's
there.
always available in the drive here. If anyone wants a specific email to them individually, I mean, you can send me an email and I'll send a link to you
And
directly.
you could take that, there's one post there.
It's always
I got
inside,
the
so.
idea, I try to be creative, so we had this big, we have tons of, like, at this point, about 16,000 we've collected over the years. And I saw this big pile of papers and I said to Brooke, I said, that's not just another pile of, right? And I said, so I kind of played off of that. And I said, this is not just another pile of papers. How to say, and your voice, and add your voice to this pile. Yeah, we try to be as creative as we can, so, and we put money behind boosting. I don't know if it
is still circulating.
Is it helping?
It has not been as impactful as it has been in the past.
Yeah, because social media is getting saturated.
Yeah.
That's why.
Yeah.
And I'm lucky we even were able to put some money, that they gave us some money to put behind boosting. And usually that's like, no, you can't have that, you can't have this. So, and sharing, you see a post, share it. I share everything.
We share like 3 posts a week. If you want to follow us, just share the posts. That would be awesome.
That's another way, and people do take it. I tend to think when you see something like this come up, you're just like,
yeah,
here we are again, they're asking it.
Yeah.
But we try to explain your voice matters because your health matters. And
Right.
hopefully people will take it. So we do that, and, but you're gonna get a big pile of copies.
And maybe next meeting, when, those of us in person, we can just pick ours up, so you don't have to mail it.
I'd rather just mail it this way, I know you have.
Okay.
It doesn't cost that much to mail a stack.
Yeah, I mean, we also have they're printable, so like you can, print them at your leisure.
Yeah,
and have
but we
them.
make it as easy as possible, so you don't even have to print.
So ones on the Google Drive, are those printable right now, those are the updated ones?
Yes.
Yes. Okay. But we do want to update those other languages.
Yeah,
so
to other
That was
languages.
something we will do.
And this survey, what's the deadline date for completion of the survey?
It's ongoing.
It's analyzed on an annual basis at the end of the year, so we'll analyze 23s in January.
January.
Right, so we'll take all of 23 and we'll analyze them in
Okay.
January. And you can see historically,
How do we get access to previous year?
you go on our website.
It is all housed on our website.
You want to go there?
I don't have a link to it right here. It would kind of be messy for me to navigate there right now.
So it's the Long Island, what is it, LI?
LIHealthcollab.org.
Where exactly, which type of, is it under healthy resources?
It's under
See,
data.
Data, see, it's a little hard to find, which is another
Yeah.
situation we're
This
in.
data assistant under member
Yes.
resources.
Yeah,
You
so
can
if
do
you, at
that.
the top, there's all data resources at the top of that page.
And hit data assist, right?
On the data assistant page, there's all data resources.
Right. And I put money.
Okay.
Okay.
Yeah.
You see, and they're all
Yeah,
there, and
yeah.
we actually been able to see some trends, and I've written some, I don't know if they're white papers or whatever, reports about some trends that we've noticed, and at one point, we did see the physical activity increasing among adults on Long Islanders. And I compared that to state and federal, and I wrote a brief report about that, and talked about the diverse members of the Long Island Health Collaborative who represent this, mental health, academia, this, that, the other thing. Have been working to improve and move the needle on this, and this is proof. Last data analysis compared to the year before shows there's been a little uptick in the physical activity of adults, and I think compared to state and federal counterparts, we were above. So I said, we'll take credit for that. So we took credit for that, for our work. Yes, and collectively, we worked on that. But what's my train of thought?
So any other questions, or if you want any items specifically from the toolkit, just send me an email and I'll make sure that gets into your hands.
I put money in the budget, I don't know if it was approved, to overhaul, to make the collaborative site, because this site was developed 6-7 years ago, had a lot of stuff on there that's not even relevant anymore. I'm trying to streamline it, so I have a bid in with a company, have money in the budget, don't know if it was approved. So I'd like to streamline it so it's easier for everybody to find everything. That's one of my goals for this year too.
Brooke, do you have any copies now? Because my next site is actually a male shelter and we do one-on-ones there,
If
so.
after this meeting is over, you have 5 minutes, I'll print you a bunch.
Print you a ton.
Deal.
Yeah.
Brooke, I have a question also. Unfortunately, I haven't seen the survey, sorry about that.
Oh, you did see it, because I printed it out for you, me and you did it
Does it
together.
ask for the name?
No,
No.
it's totally
Anonymous,
anonymous.
completely anonymous.
It does ask demographic information.
Yeah,
but
'cause
no
I
identifying
took
But
information.
it doesn't ask as far as citizenship, residency, because I have a lot of students that are non-documented, so, you know, it's all.
We don't ask
I don't think
citizenship.
that is,
No.
one of the questions though is, what prevents you from accessing healthcare? And this last go around the groups, we had just the word fear and we said fear/immigration status.
We added some examples and that's one of them.
So we can get a sense of this. If a lot of that is being checked,
Okay.
you can assume that it's because they're undocumented.
All right, good, thank you.
Anything else about the chats?
Anything else about the CHAS? No, just we need to get more surveys in because.
Do we have a target number that we're shooting for, or is it
My target,
percentage by this code?
my target number is as many as, it's again, convenient sampling, so who's
Yeah.
ever gonna take it? And who's ever gonna hand it out? So obviously, yes, those underserved areas, if we could get more representation from those areas, that would be helpful.
If someone has filled out a survey before and now it's a new year, should they be filling it out again?
Not really.
No, okay. Just making sure.
No, I would say that. Yeah, that would be counting twice and then that wouldn't be accurate. All right, what?
Just some other reminders we wanted to give you. Collaborative Communications, our bi-weekly newsletter. If you have any events, resources, jobs, etc., you want included in there, just send them to me and they will be included.
And that's getting longer,
Thank you for sending
that's
yours.
getting
I know, I
longer
see
and
so much.
longer that every couple of weeks, there's so much, but we don't want to leave anyone out.
We try to
so-
keep it timely though, like if you have an event that's happening like 3 months from now, like I might hold off, you know, to include that until it gets a little closer, so just bear with us with that. We want it to be as like wieldy as possible while including as much information as we can, so. You can also submit your events to the events calendar on our website, the link is there, and we directly approve them, so, feel free to add
And back
those.
to the collaborative communications, it's every 2 weeks, so you can't send us something on a Thursday, we publish on a Monday, right?
Yeah, it's every other
So
Monday.
we can't get it in then, so just be mindful.
And then Walk with a Doc, Walk Safe with a Doc, we are continuing into next year. That is our program that Dr. Keasha Guerrier participates in. If you would like to organize a walk for your organization for any reason, we would love to partner with you. We do all of the coordination, promotion.
You do everything, you
Just
just
ask
have,
for your help to cope.
you just have to find the spot, not even
Not
find
even
the spot.
that, yeah.
Sometimes we find the spot, you just have to find the doc, and we've used non-docs too, we've used physical therapists, we kind of
Shout out
like.
to Jackie Grimaldi, if she's still on the call.
Yeah.
She has spoken before.
We stretch the rules a little bit, you know, sometimes, but, you know, mental health
Community health
practitioner,
education specialist,
health
yeah.
education specialist, but it's supposed to be a doc, but.
So yeah, reach out if you're interested in any of that. And we also just want to bring your attention to our Keep Long Island Covered campaign, which we do have flyers there in the back if you think that your clients could benefit from this.
Yeah, and can I explain what that is?
Please,
So
yeah.
that is, so you know, everyone has to recertify for Medicaid now, right? So
Yes.
there was the 3-year where they said they you got a free pass. So they started doing that in April, June, April, May, June, whatever, April, right? And so people are getting letters, oh, you have to recertify, because Medicaid, you have to recertify every year, because your eligibility, your income could change. Some people who enrolled in Medicaid toward the end of the pandemic, kind of not gonna get their letter for many months from now, so it's gonna be like kind of a rolling thing. So this agency here, Nassau Suffolk Hospital Council, we've been enrolling individuals in the aged, blind, disabled Medicaid program, dual eligibles, Medicare, Medicaid, for many years. We received the grant from Community Service Society of New York, who wants to make sure everyone who is eligible gets re-enrolled. That's what this is all about, and that's why we want to keep Long Island covered. So if you take a stack of information of flyers there, let us know, because we have to keep count of the flyers we hand out for our metrics. And you may have clients or patients or individuals. And do we have it on the site? It's on the site too.
Yes, they're all on the
There's a
website.
separate site though.
Coverage
For the
healthcare.
number 4 healthcare, where all of our enrollment takes place. The sites that our enrollers are at, they're at libraries, community churches, they're all over the place. And then you can talk about it.
Oh, yeah, and we just wanted to draw your attention to the fact we just launched a Tame the Triple Threat campaign encouraging folks to get vaccinated against COVID, flu, and RSV. That actually just went live this morning, so those assets will be available on our website. I will include the link in the meeting summary in case you want to post them, accompany your own messaging with them, etc.
And I just read yesterday that the State Health Commissioner declared the flu prevalent.
Yeah, I heard that too.
So once it's declared prevalent, any healthcare worker who has declined to receive, I think it's mainly in hospitals, I don't know if it extends to, I think it extends to.
I think it's hospitals and private practices.
It is, right?
Yeah.
Who has declined a vaccination for whatever reason, and if they're in direct patient care, then they have to wear a mask. So during the pandemic, it didn't matter if the flu was prevalent, because everybody was wearing masks. Now, that's, so if you see somebody in a doctor's office wearing a mask, it's because they were probably not vaccinated, or they could just be extra cautious. Can't make a judgment call there, but, so I did see that it's prevalent, because that's the first time it's been declared prevalent since before the pandemic. So.
Yep, so that will be available, and these are our 2024 meeting dates.
And you'll send everybody, did you already send, Outlook invites or whatever invites? I know
No,
I
so you
got
do
it.
have to register
Oh.
to get the link for these, so the registration links are gonna be on our website. You know, actually, I don't think I had a chance to add them before this meeting this morning, so they'll be up and live by tomorrow, the latest. And you can register and get these dates on your calendars.
But when we send out the recap for this meeting, it
Yeah.
always says, give the registration link, here's the next meeting, and we start talking about the upcoming meeting weeks before, so.
Yeah.
But you can at least put them on your calendar.
Yeah.
And you'll get these slides, so.
Yes,
And
yeah, these slides, the summary, and the recording.
And it's
will be
just,
online.
almost 11:30, I thought you guys were gonna get out early. Oh, sorry.
This is good, yeah.
Yeah. All right, and you made some connections
Yeah.
and who do we have to get copies?
Oh, and anyone who did not sign in.
Oh, I did not.
If you could
And do
please
you
do
have
that, that
copies
would
of
be
the agenda?
wonderful. Yes, the agenda is.
Okay, never mind.
No, I'll grab you.
This was wonderful, thank you.
Oh, yeah.
Everything that you're doing is extraordinary.
Tell our powers that be that.
Sign.
So they don't sorry. Yeah, it's not worth it.
It's really the social, like you. But it's the social passion that at times, it's like that.
I know.
It's me. What you're doing here is really high. That's what you do. I'll write that.
I'll tell you who to send it to.
Okay. No, don't, please send that out in the email.
I'll send it
Within
out.
minutes.
Send it out.
And then in the,
We'll send it to you privately.
Feedback, please.
I'll send it out privately.
Yeah, this is 2 hours. So, the reality is that I